can see that a lot of change have come up now over the years. I think, especially with the new generation. But I think there have to be some ethics. So based upon the problem, so that's how they are trying to survival of the fittest. They are trying to do. And in our department, we have 16 patents in total. You need to educate the patient. But I think making your own money out of patient's pocket is absolutely unethical. Formulated about 4 to 5 herbal gels and the herbal drugs, which we can educate the patient and which we can try it on them, and it's absolutely free. That if you are a good dentist and if you are a good doctor, definitely patients will come to you.
Hello, RITZ viewers. In conversation today, I have the first women dentist to receive the highest degree, that is Doctorate of Science. We have Dr. Jaideep Mahendra with us. Hello, ma'am.
Hello.
How are you?
Yeah, I'm absolutely fine. Great.
Congratulations on receiving the highest degree, that is Doctorate of Science.
Thank you.
And I have no idea about all this until I read your that press release, and I was amazed to see your journey. So I personally wanted to ask a lot of things in that. So what was that thing? What made you to pick this? Like nobody has done this in India. No women has done this. So what made you choose this? That you have to aim for this and achieve that.
Actually, my journey starts long back when I started my career in dentistry. So, since dentistry is a very fascinated field, not many would like doing with their hands, and because once you become a dentist, you become basically a dental surgeon. So it's not only the studying, it's not only giving or treating the patients, but it also educating the patients, making them aware about their oral hygiene. And dentistry is a very vast field. So it's not only related to the oral cavity, it's not only related to the mouth, as most of the people are not aware about. What I feel that as a dentist, I felt at that time that we need to rise high a much, that we need to talk to, that we are able to talk to our audience in a way that we need that we tend to tell them that the oral diseases are not only confined to the oral cavity. There are various other diseases which can even spread from the oral cavity to the other parts of the body. It can affect the heart, it can affect the lungs, it can even affect the kidneys. So keeping that idea in mind, I thought, why not to research in that aspect.
Awesome. And as you said, people tend to, take it in a very, they give very less importance for the oral health. They don't visit dentists often and they don't have any awareness, much awareness. Now it is a little changing, but yeah. So being in this field, how do you convey that importance to people?
Actually, we have a lot of programs. We arrange a lot of dental camps, and like last year, we had arranged the various camps in the various other sectors of the society. We went to the Coimbatore bus stand, and we did a lot of encouraging programs like mines and various other what you see dramas, and also that people are attracted to, and we would make them realize that how important your oral hygiene is. In the same way, we also went to the metro railway station, and in the train we had educated the the passengers.
So nice.
So like that, we pick up quite interesting areas where the people are ongoing and they are doing their regular job, and we just talk to them, and that's how we tell them. And apart from that, we have also organized camps in various schools and the colleges aspect. So, and we keep on publishing a lot of articles in the press, so that people become aware about the oral hygiene.
And you are a periodontist.
Yes.
So, what's the difference between dentist and a periodontist? What is the areas that you deal with?
So, dentist is a person who basically achieves a degree of Bachelor of Dentistry. So, he can be called as dentist. And if you go ahead doing an MDS, that is Master of Surgery in Dentistry, then basically there are various specialization. There are 9 specialities, and my this thing is periodontology. So I am basically specialized in periodontology. It deals with the gums, infection of the gums.
Okay.
So if you have any kind of bleeding in the gums, while you're brushing, or if you have like abscess, like a pus or like a swelling in the gums, so we are the one who basically treats So that's how we basically take care of the oral cavity. We take care of the mucosa, we take care of the tongue, we take care of the palate, and we take care of all the pink tissues of the oral cavity.
So please tell us, what should we do to maintain a healthy gum, or a simple thing which we can follow regularly?
Actually, what I feel that every person, morning and night, he has to brush his teeth. That is everywhere. It's absolutely known, but usually we tend to forget, especially at the night time. We tend to forget.
Yeah, so lazy to do it.
Yeah, we are a little bit lazy, and we keep on doing a lot of our own routine activities. And once we are on the bed, we don't tend to go out, and to brush our teeth. So I think that should not be there, and we need to brush our teeth twice a day. Apart from that, we tend to decrease our sweets because these are the main culprit. And if now Diwali is coming and we tend to we would feel like eating a lot of sweets. So if you want to have sweets, you have at a time, and at the same time, just after having sweets, you make sure that you go and brush your teeth. So that's very, very important. Apart from that, you have to gargle your mouth after every meal. That's very important. And you need to have a good diet, because if you have more fibrous diet, more green leafy vegetables, so that's not only good for your health, for your body, but also good for your gums.
Okay,
Yeah, and the
that's a
teeth.
very good tip.
Yes, yes.
Yeah, and I wanted to ask about this holistic approaches towards everything, because nowadays every advertisements or clinic marketing, they use this word called holistic approaches. So please tell me, what is it about having a holistic approach towards anything? So please, you have to give me what is it, so that the audience also understand and approach people accordingly.
So actually, I have done a lot of research in holistic approach as a dentist myself. So that was a part of my research work. So basically, as a dentist, we basically tend to provide a lot of medicine to the patients who are basically ill with any kind of dental diseases. We know that India is a rich country of many herbs and the plants, and most of our people who are staying here, even in Tamil Nadu or even outside Tamil Nadu, they are not aware about the most of the medicinal plants, and they are very, very beneficial for our gums. They are very, very beneficial for our teeth. So I had been working on spirulina, I had been working on mangostina, and many other herbal plants, and we have basically formulated a gel, and that gel can be incorporated into the dentrifices, and it is absolutely safe without any chemicals, and it has shown quite good interests. So I think these are few areas where you have to work on, and there is basically a gap between now we are producing a lot of herbal medicines. So now there is a time has come, now we tend to basically publish these medicines to the commercial companies so that they manufacture it and it should reach the masses. So that is our approach.
And nowadays, talking about the social media and the marketing industry, so every dentist here nowadays, I tend to see a lot of advertisements, and I see dentists do different things to pull in customers or pull in their clients. So how do you see this change of marketing? Because before, doctors don't dance, doctors don't sing. Nowadays we see a lot of dentists or doctors, they dance, they do reels, they pull in clients, they attract their clients in that way. So do you think, is it necessary for a doctor or any dentist to do all these things apart from giving medical inputs, advices? They tend to do a lot of other things. So how do you see this change in today's?
Yeah, I can see that a lot of change have come up now over the years. I think especially with the new generation, and since there is a cutthroat competition, because there's dentists coming up every year. BDS degrees. You can see so many dental colleges out here in Tamil Nadu, and everybody have to survive in one way or other, and jobs are very less, vacancies are very less. So based upon the problem, so that's how they are trying to survival of the fittest they are trying to do. So that's how they're going to get into. But I think there have to be some ethics in dentistry, and that's what has been taught to us also, and that's what we had been teaching to our students. Sometimes, if any of the patient will come, I've got this problem, they'll say thousands of problem, and they'll just try to grab the patient. So I think that should not be there. I think it is your main, this thing is that you need to see what a problem the patient is having, and it's a patient's choice. You need to educate the patient. But I think making your own money out of patient's pocket is absolutely unethical. And we have a subject called as ethics in dentistry, and we teach them.
Okay.
Yes. So I think because of the changing scenario, the people are also changing. But I think we should understand that if you are a good dentist and if you are a good doctor, definitely patients will come to you. No other way. No, patients will come to you, and you should develop a skill to talk to your patients. You should be a very good listener. First, you have to listen to your patient. What exactly is the patient's complaint? Then only you have to decide the treatment, and then you have to tell the patient, this is the treatment, whether this way or that way. What is your, because patient will also see their budget. Based on that only they will come. So all these things have to be taken into consideration. So I think reels and all which you have told, I think might be the younger generation will be,
Yeah, I see a
going
lot
ahead
of
with now.
doctors,
Yeah.
they show their lifestyle. Like, I come to you for your thing,
Yeah.
but they show their lifestyle, how they dress up, what brands they use, and
Yeah.
all that. And I feel diverted. I
Yeah,
don't
it
want
has
to
been.
go
Yes.
to them as a client, but just I want to look at their lifestyle and just be here only. So that I wanted to ask. And talking about the patents,
Yeah.
so you tell me, what is it all about? So you have 12 patents with you?
Yes, yes.
So how did that happen, and what all patents you have with you?
Actually, while working, towards a with the journey of research, we have innovated few things, and we have innovated certain ideas to undergo. Like we have formulated about 4 to 5 herbal gels and the herbal drugs, which we can educate the patient, and which we can try it on them, and it's absolutely free. And it's absolutely because in our college we are giving them free of cost. When we were searching for these herbs and all, we thought like why not to patent it. So first we searched that whether anybody else have been have done that. So we searched and searched, we couldn't find. So then we thought, we got into idea like yes, we should patent it. So that's how I
First
could
one to do
patent.
that also.
Yes, I'm the first one to have 12 patents under my this thing research activities, and in our department we have 16 patents in total.
So how does it feel to be the first one in everything? Because you're the first one to hold the PhD, first one to get the doctorate of science, first one to hold 12 patents. So being the first, is it a pressure, or how do you take it?
No, it's not a pressure. It just came on its own way. I think so. I never thought that I'll do DSC. I never thought. It never came into my mind. I was just going through the research, after doing my PhD, and I was guiding various students. And once you are into that, then you become addicted to your research and you keep doing it. Then one of my colleague only said, like, Madam, why don't you apply for DSC? You have got so many paper publication. So it just came by itself. So I never had it in my mind as such. Then I thought, okay, why not to apply it, and why not to submit my research work and as a thesis. So that's how I just came across everything. But I feel that I'm blessed in a way that it would be a lesson, and it could be encouragement for the juniors also. They would see, you have to see somebody to come up to that. So I think they are very happy. All my junior faculty members are very happy. All my students are very happy, and they are also doing a lot of research. Like I have now about 4 to 5 staff members are pursuing PhD now. So I think in one way we are encouraging our new generation also into the research.
So you have opened doors for a lot of.
Yes, yes, and we feel very happy, if in case they are doing, and we are always there to guide them and support them in all possible ways.
Explain me the tree, the link tree of this
Okay.
degrees.
Actually, as a dentist, I just